Dear friends and colleagues, today I am going to talk about another hot topic which is very important for any entrance exam, including Mrcp Part 1, Part 2 and PACES exam. In PACES and Part 1, Part 2, Mrcp Part 1, Part 2 exam, why it is important? Because this disease is very common in European people. You will get one patient in every 100 to 300 people. For that reason it is very important, we need to know. Okay. Number 2, it is curable disease. If you diagnose this patient earlier and you can start treatment, it is curable disease. Number 3, you can prevent complication, which is very important, because if you delayed, this patient may develop one kind of non-Hodgkin lymphoma, enteropathy associated T cell lymphoma, and you will get atrophy of the spleen. So, you just diagnose early and treat earlier, you can prevent this. For that reason it is very important. So, would like to talk about this, and you need some basic concept to answer the questions in exam. Okay. So, what type of disease it is? It is an autoimmune disease. Autoimmune means female predominant. So, this disease also female predominant. You will get more female patient in this disease. So, some association also are there. So, you have to do this test for HLA-DQ2, it is 95% cases you will get, and you will get others HLA association, HLA-B8, HLA-DR3 and DR7. So, this association you will get. What happened actually? In our some food, there is one component, one protein, gluten. So, gluten present in some food like wheat, barley, oat, rye, this type of food, this gluten present, and it is responsible for this disease. If you want to say specifically, then you can say the gliadin fractions of gluten protein is responsible for this. So, in the gliadin portion of the gluten protein, it activates CD4 T cell, which is the key factor for inflammations of the disease. So, repeated taking gluten containing food, the gliadin portion activate CD4 cell and cause inflammations of the jejunum and duodenum. So, due to inflammation, the mucous membrane of the jejunum or duodenum has got subvillous atrophy, subtotal villus atrophy actually, that is villus will be atrophied, and the surface area of the villus, that absorptive surface of the intestine will be reduced. So, what happened? If absorptive surface reduced, the nutrient, minerals, whatever essential component for the body will be reduced. So, there will be malabsorption and deficiency syndrome. So, let us talk about the inflammation. Any inflammation can cause pain. So, this patient will complain abdominal pain. When there will be abdominal pain, patient will complain nausea, vomiting, and as component is not absorbed properly, There will be malabsorption means there will be diarrhea also. So, this diarrhea is sometimes intermittent, sometimes chronically present. So, this patient will present diarrhea, vomiting, nausea, abdominal pain and deficiency of vitamins and minerals. Now, what vitamins deficiency will be there? Iron. Just remember, iron is the main component will be reduced here. So, there will be iron deficiency anemia, that means microcytic hypochromic anemia. Another component vitamin folic acid will be deficient. For that reason, you will get macrocytic anemia. So, you will get dimorphic anemia. So, when you will do peripheral blood film, you will get dimorphic anemia. Okay. So, anemia will cause fatigue of this patient. Patient will feel fatigueness. So, this patient always feel fatigability. So, other cause of fatigue also I will discuss, because this is autoimmune disease, and this autoimmune disease associated with other autoimmune disease like hypothyroidism, type 1 diabetes mellitus, autoimmune hepatitis leading to liver cirrhosis. So, if any patient is having hypothyroidism, definitely this patient will feel fatigueness. If any patient cirrhosis developed because of autoimmune hepatitis, he will also combine the fatigability, and any type 1 diabetes also will get fatigue. Yes. So, this patient is complain of fatigue all the time. Okay. Another thing, that patient will have weight loss. Here I would like to talk about some other causes of weight loss with diarrhea, but appetite preserve. This patient will have appetite normal, but there will be weight loss. Other diseases like thyrotoxicosis, good appetite, weight loss with diarrhea. Diabetes mellitus, good appetite, weight loss with or without diarrhea. Okay. So, this patient and any malabsorption may cause weight loss with diarrhea, but good appetite. Laxative abuse can cause good appetite and diarrhea. Okay. Just remember this. And this patient has this patient will have some association of some other disease. Already I mentioned the autoimmune disease, but it is also associated with one type of skin disease, which is intense pruritus. This vesicular rash present in the back, elbow and arm. This is dermatitis herpetiformis. So, we will get dermatitis herpetiformis of this associated with the disease. Another association is immunoglobulin A deficiency. Around 10% cases immunoglobulin A deficiency will get. Another association is hypertrophy, that is atrophy of spleen. That atrophy of spleen cause hyposplenism. Another association, if this disease continue more than 1 year, then this patient may develop enteropathy associated T cell lymphoma. This is one kind of non-Hodgkin lymphoma. So, you have to remember this association with this disease, and in exam they will give the scenario with the associations of this disease, maybe in the form of dermatitis herpetiformis with malabsorption symptoms, iron deficiency anemia with malabsorption with type 1 diabetes, or combinations with autoimmune hepatitis plus celiac disease. Sometimes it that causes the deficiency of calcium absorption. So, calcium absorption can cause osteoporosis. So, there will be osteoporosis in case of celiac disease, and you have to remember this also, because your examiner will test your knowledge about associations of the celiac disease. This is very important actually. Okay. Now, how will diagnose? Already I mentioned the sign symptoms: diarrhea, nausea, vomiting, abdominal pain, sign symptoms of iron deficiency anemia, sign symptoms of diabetes mellitus, hypothyroidism, autoimmune hepatitis, cirrhosis, and deficiency of calcium, and associated disease like hypo immunoglobulin like immunoglobulin A, and also lymphoma, also dermatitis herpetiformis already mentioned. So, this type of association will be there, just you remember this association. Okay. For diagnosis there will be different kinds of test, but immunological test is the first, then biopsy and radiological test and other complication associated test we need. So, before that you just remember the 10% case that immunoglobulin A will be deficient. So, for that reason it is better to measure immunoglobulin A, so that there will be less chance of false negative. Another thing, if patient previously not diagnosed, that is he is on gluten included diet, gluten containing diet, you can do serology, that immunological test. If patient is already on strict gluten free diet, then your immunological test may be negative. For that reason, if possible, just reintroduce gluten containing diet at least 6 weeks prior to do the immunological test. Just remember this. So, immunological test, first test is anti-tissue transglutaminase antibody, immunoglobulin A type. If immunoglobulin A deficiency, already lack of immunoglobulin A, if you see, then it will be false negative. For that reason you have to do immunoglobulin G. So, anti-tissue transglutaminase immunoglobulin G type. Another test, anti-endomysial antibody, it is also immunoglobulin A and G type. Again, if there is immunoglobulin A deficiency, then if you do anti-endomysial antibody immunoglobulin A type, then there is a chance of false negative. So, you just do immunoglobulin A and immunoglobulin G type also, anti-endomysial antibody. Anti-gliadin antibody you can do also, but NICE usually not recommend that anti-gliadin antibody. Anti-endomysial antibody is highly sensitive, around 90%, and highly specific, around 100% specific. Okay. Still there is a chance of false negative. For that reason, the gold standard investigation is biopsy from the duodenum or jejunum. So, by endoscopy you can take biopsy. What will be the finding of biopsy? You will get villus atrophy, crypt hyperplasia, then in lamina propria T cell lymphocyte infiltration, intra epithelial T cell infiltration, sometimes plasma cells in that epithelium. So, these are the findings of duodenal or jejunal biopsy. Okay. With this test, other test will do to exclude the other disease or complication, like fasting blood sugar level to see whether there is diabetes or not, thyroid function test to see whether there is a thyroid function abnormality present or not, that is hypothyroidism present or not. Liver function test to see whether there is autoimmune hepatitis or CLD or cirrhosis are there or not. CBC will do to see iron deficiency anemia or macrocytic anemia due to folic acid deficiency. Vitamin B12 deficiency usually not occur because it absorbs in the ileum, but if due to autoimmune disease, if there is a problem in the intrinsic factor of Castle's or other autoimmune disease, that pernicious anemia, then you can get the vitamin B12 deficiency, otherwise not. Okay. If you do peripheral blood film, you will get dimorphic blood picture, that is microcytic and macrocytic both, and because there is a hyposplenism, you will get target cell and Hubble jelly body in the peripheral blood film. Okay. Now, other test, calcium will be low. So, for that reason patient may develop osteomalacia or osteoporosis. Because of diarrhea, there may be potassium loss, so hypokalemia you can get also, and electrolyte imbalance you can get. So, this electrolyte imbalance also will be the cause of fatigueness. Okay. So, these are the actually investigation. Another investigation you can do, that is radiological contrast radiological imaging, which may show the loss of fold in the jejunum and increased fold in the ileum. Sometimes it is called jejunitis of ileum. Okay, because the compensatory fold increase in the ileum, it is not important, so leave it, not necessary. Now, treatment. Here actually there is no specific treatment, only treatment is strict dietary restrictions of the gluten free dietary restriction for lifelong. This is the treatment. So, patient will think that doctor didn't prescribe any medication, and he will be searching here and there, I need proper treatment, something like that. For that reason, patient education, counseling, explanation of the condition is very, very important to be adhered to the treatment, that is dietary restriction. So, you just involve one dietitian, he or she will prescribe the dietary chart, which is gluten free diet. Even during traveling, patient need to inform prior to traveling to the authority that he has gluten sensitivity, for that reason one gluten free diet. Thus, he can prevent the disease, and after 6 month treatment he will be okay, his immunological test will be negative, and the lymphoma, non-Hodgkin lymphoma will be reversed. But if hyposplenism develop, it will not reverse, unfortunately. So, it is very important for this patient. Treatment of dermatitis herpetiformis, because it is very intensive pruritus, and patient will develop this, and patient the daily life, the functional life will be disturbed. For that reason, Dapsone you can prescribe to prevent the symptoms. Sometimes patient may need steroid. Treatment of other associated is iron deficiency, so you need to treat with iron supplementation. You need to treat other condition. If there is hypothyroidism, treatment of hypothyroidism, and you can involve endocrinologist. Treatment of CLD, you can involve hepatologist. Treatment of electrolyte imbalance, so you can supplement potassium, you can supplement calcium with folic acid and other minerals which actually you will get the deficiency, and you can involve endocrinologist for type 1 diabetes mellitus management also. So this is the celiac disease, and I think if you remember this thing, you can get all the questions from this. And thank you very much, my friend. Stay with me, subscribe my channel, and I'll be coming very soon with another hot topic, another video to you. Thank you very much.